Pregnancy can be the most beautiful yet stressful time in a woman's life. In Ayurveda, antenatal care is called Garbhini Paricharya. Special care is essential for safe motherhood and healthy progeny. Matrujiva Mantra is a special wellness program that gives complete guidance in pregnancy or antenatal care. Last week, we started a conversation with Dr. Trupti Gaikwad. She's an expert, Ayurvedic expert. Month-wise, customized specific dietary regimen, or whether it's activities or physical and mental well-being during pregnancy. She's an expert and she will guide you through. In this program, Matrujiva Mantra, we have a 3-program series. We started with Preconception, and today we're going to talk about antenatal. We're going to learn how to manage pregnancy-related issues and other concerns during pregnancy, whether it's constipation, whether it's allergies, whether it's vomiting, or is it headaches. Let's welcome Dr. Trupti Gaikwad to the show. Welcome to the show, Dr. Trupti. How are you?
Namaste, Madhviji. Thank you. I'm very good. How are you doing?
Thank you, Dr. Trupti. I'm doing very good. I'm so glad that we started this conversation about pregnancy right from conception. We had a basic introduction in the last series. And today we're going to talk about women who finally get the good news that they are pregnant. There's so many thoughts that happen, and there's so many changes that happen physically. And we all have heard that you have to take care of yourself during pregnancy. Now, in that entire sentence, yourself is me, I, me, myself. And in today's world, it is definitely a struggle. The pressure of motherhood, the joy of motherhood, plus taking care of yourself between your work and personal life. How is that possible? And what should a woman say, this is a stop point and this is a start point because I'm pregnant now?
True. Yeah. So as you said, pregnancy is excitement, pregnancy is happiness, and same time pregnancy is confusion.
Mm-hmm.
Right. So it brings all that, and there are a lot of physical changes, lot of psychological changes happens during pregnancy. Mm-hmm. So once women find out that I'm pregnant, first thing is happiness. She is excited, she is very happy. And other side is how do you manage your day-to-day life with this pregnancy, because everything is going to change. And most of us are working women. That is another task we have in our life. Mm-hmm. So making our body physically and mentally stronger for upcoming delivery and going through all those 9-month changes during pregnancy is very important. And during pregnancy, as you have mentioned, we go through a lot of changes, and we have other issues like having constipation or bloating, so small things, but they trouble us. Your sleep is you're not gonna sleep properly throughout the pregnancy, right? So one day if we don't sleep, how do we feel next day? So think about pregnant women going through all these changes all 9 months, right? So making our body and mind capable, strong enough, and enjoying the pregnancy is our goal.
In this beautiful conversation that we've started about the good news of somebody being pregnant, so many thoughts. How will I do it? Who will help me? Where do I go? Am I doing the right thing or this is wrong? We all want everything natural in life. There's so much of information out there, so many tonics, herbs, vitamins all floating around with somebody's experiences also coming in. Everybody out there who's already been pregnant or had a baby, they come with their pieces of advice. But in this program, we want to debunk certain myths and also help the new age mothers to understand what and how Ayurveda can help. So please do enlighten our viewers today that how Matrujiva Mantra can benefit during pregnancy.
Sure. So Matrujiva Mantra brings everything to you. In Ayurveda, in Garbhini Paricharya, the most important thing has been told is diet. And diet is not same all 9 months, because your day is not same all 9 months. Each month baby is growing, so you have changes. First 3 months, morning sickness is very common. So Ayurveda brings a special diet for first 3 months. Ayurveda brings special activities or doing some yoga asanas. We have spoke about doing yoga and exercises or meditation at the time of preconception as well. So during pregnancy, yoga and meditation is not the same. During pregnancy, it changes. It is more customized for you because your body is not same as non-pregnant women. So you have to take care of it when you do asanas. And these yogasanas or meditation or breathing exercises are more focused for your pregnant body, making you capable going through that physical and mental trauma during delivery and even after delivery. We know we have seen lot of changes during all this phase during 1 year, and this is not one day. This is long time. 1 year is such a long period. So having diet in second trimester is different. Third trimester dietary guidelines are different. So through Matrujiva Mantra, we will conduct workshops for you. You will have one-on-one session. You sit and talk with Ayurveda expert. You discuss your health. If they have any other health issue, we know how many health issue can be manageable without the medicine during pregnancy. Because taking any medicine during pregnancy is not a good idea. And still we are not talking about other health issues can be induced during pregnancy like piles or gestational diabetes,
swelling of the feet and other things.
Swelling of feet and other things. So through Matrujiva Mantra, it is going to be more natural with the diet, with exercise, having yoga, and there are a lot of other things involved like mantra chanting, which is optional. If you want it, we can do that. There are a lot of things, and baby visualization is another thing we are going to cover up in Matrujiva Mantra.
Dr. Trupti, you're just mentioning about diet, and I'm sure all kind of dietary habits we all have built in and grown up with. Now, during pregnancy, there are certain cravings for certain foods, which could be good for you, which could not be too very good for the baby also. There is also something called a non-veg diet or vegetarian diet. So do you accommodate those particular needs in the diet plan?
Yes, definitely. Because keeping lady mentally active and mentally happy is another important thing we have to manage during pregnancy. And sometimes there are so weird cravings, and that might be middle of the night. You never know, right? So yes, we definitely customize. That's why I'm saying it's more customized. If you ask me particular diet, what should I follow? First, I have to sit and talk with you. To understand your body type, to understand your lifestyle, to understand your daily routine, because we do not want to force anybody to have particular diet just during pregnancy, which has a negative impact on their mentality, on their mind, and which we don't want that. Right, so it's more customized. That's why this one-on-one session with me or with Ayurveda expert in Matrujiva Mantra is very important.
Dr. Trupti, you've been talking about mental health, and I'm sure this is a well-spoken about topic outside. But during pregnancy, the stress level is so high. Taking your physical care of your own body and taking care of the unborn child doesn't come along. You need to put a little more extra effort for the pregnant mom to do that. So how does the mental health of the mother affect the baby? We've heard a lot about it, but today, can you please explain through a string as what the attachment of the mental health is? How does it affect the baby?
Sure. So when baby is growing, baby tries to adapt, baby tries to grasp everything from external world. And what is the connection between baby and external world? Mother is the connection between baby and external world. So baby doesn't know what is happening outside. Baby tries to understand everything through mother. So whatever mother is thinking, whatever mother is watching, even if she is watching any crime show over the TV or reading some news, whatever mother is doing, baby will try to grasp that, baby will try to understand that. I'll give you a simple example. First time pregnancy, mother is going through a lot of changes, working, and nuclear families, does not have any domestic help or anybody, family member around her. So she is going through a lot of stress, and top of that, she is more emotional for her upcoming baby, right? And then she is trying to manage everything, her work-life balance. Result, they will not be able to sleep properly. During pregnancy, already they are not able to sleep in their desired position. Right, all those things. So they will start to think like, because of this pregnancy, I cannot sleep. Because of this pregnancy, I cannot eat this. Because of this pregnancy, I cannot drink the wine. Right. So all that baby is listening. So indirectly, you're blaming your own baby. So baby takes that as a negative. impact.
Mm-hmm.
So baby thinks in that way. So these small things matters a lot, and through Matrujiva Mantra, exactly we are going to do that. We will be able to guide you. How do you keep these negative thoughts, or if somebody else is talking something negative in front of you, still how you will manage to keep those things away from your baby.
Mm-hmm. So that's interesting. So I've also heard the terms called baby visualization and integrating things. What is this terminologies and how is it implemented during the program?
Yeah. So baby visualization or integrating some values in your baby.
Uh-huh.
Baby and mother, they are spending time 24/7 together, since they are two lives but one body.
Uh-huh.
But are you spending real time with your baby, or you're just carrying your baby? That thing matters a lot.
Oh,
I
there's
mean,
a difference in that, Dr. Trupti, that if I'm pregnant, the baby is with me, I'm spending all my time with the baby, but then still there is a difference that I'm not spending time with the baby.
there is a difference in spending time physically and having your involvement, mental and physical involvement in your baby. Since you are carrying baby, there is no wonder you are spending time with your baby. But if your brain is involved in external thoughts or external activities all the time, and you're not realizing that your baby wants to talk to you, your baby is grasping whatever you are doing. So that is not that is not spending real time with your baby. So these baby visualization, where we will guide you how to do it, and we will teach you how to spend real time with your baby, valuable time with your baby, where you will start imagining your baby, how baby is growing from inside, what happens. Women should understand what exactly happens during pregnancy. Then that natural connection and those emotions, right? Every mother has those natural emotions and connections with the baby, but keeping that positive impact on your baby's mind is very important. When baby is growing, especially 6 months to 8 months, neurons, which are our brain cells, they are developing tremendously, like millions. So that time baby's brain development is fastest, I would say. So that time baby is grasping everything. And if you are watching some crime show, or if you are stressful, or if you are surrounded with people who are negative, or if you are surrounded with environment where your mind is not happy, so that time definitely baby is grasping all that. So this is your job. We cannot quit our job, or we cannot change our environment. I do understand that thing. But within that period, or by staying in same environment or having everything same, you can make changes in your baby's life, because you're the one carrying baby, you're the one gonna talk with baby, and you're the one baby is understanding everything through you. Right? So that is something.
I'm sure many moms who are watching this program must be wondering, where was Matrujiva Mantra when we were pregnant? But nevertheless, information at any point of time is always good, always helping the next generation. Yes, we have heard and we do understand from grandmom's tales also that whatever the mother does, it affects the baby. But how it affects the baby, that was a beautiful explanation by you, Dr. Trupti. Dr. Trupti, we're talking about pregnancy-related issues. Basically, when a woman is pregnant, what other subsidiary problems that could come up, like swelling of the feet or headache, migraines, constipation, diabetes. And talking about diabetes, we're hearing a lot about gestational diabetes also. There's also some pre-existing condition the woman possibly may have. So at that point, how does Ayurveda come in place? Do they consider all this? They give medications for that, or it's only through diet plan that it's taken care of?
Yeah. So if it is something existing disease like diabetes or high blood pressure or any other health condition, as we have spoken in our last session, we have to manage that first before conception. However, if pregnancy happens and if lady has those issues, so this is more customized thing. That's why we have to have one-on-one consultation where we will understand their prakriti, we will understand what needs to be done and what medicines they are already taking, and how with Ayurveda and with some simple herbs or making some changes in their diet, how it can be beneficial for them. For example, let's say they have swelling in their feet. So we will guide them through Ayurveda. There are some oils that are extremely beneficial. So if you just massage, warm it up, just massage on your feet every day, and or put pillow when you are sitting on your sofa under your feet. So small guidance will help them a lot. A morning sickness. Ayurveda has excellent diet plan for pregnant lady where they deal with morning sickness. What should they take in the morning, what should they take in the evening. And since I'm not able to tell you now particular food items because everybody choices are different, everybody's from different culture and different background, they have different food items in their food, and it's more about their prakriti as well, their body type as well, of course. But definitely once you come to us, we will be able to customize your diet. And some forget about all this, forget about diseases. Just having Brahmi Grutha, when I said 6 months to 8 months, where your baby's brain is developing very fast, neurons are building up very fast. That time, if pregnant lady is having Brahmi Grutha, between 6 months, between 5 months and 8 months, I would say, that will be extremely beneficial to develop baby's intellectual power. Because baby is taking whatever you are taking. So there are so many herbs. There are some herbs which will help you if you include them in your diet. It will help them to get reduce the swelling on your feet or reduce the backache. Backache is a very common problem during pregnancy. So there are some asanas or there are some position. How should you sit? How should you sleep? All those things we will cover up during the workshop.
Dr. Trupti, usually because people always have this fear that if they take any medication during pregnancy, it could harm the baby. But with your assurance and understanding that there's so many natural home remedies also available that can take care and reduce these symptoms and make the mother more comfortable mentally as well as physically, it is so assuring. And this is exactly what Matrujiva Mantra is about.
Yes, it's all about that. And even if they are not comfortable, even if we don't need medicine, first we try to manage with the diet and home remedies. Next step is integrating any herb or any other medicine. We don't focus directly on medicine. Never, not at all. For example, let's say they have constipation, simple constipation. Just get the resins, soak them in water. Next morning, eat those resins. Just soak some almonds, eat them. It's a good fiber. They give you this, they are good iron supplement. It's good nourishment for your baby. So small things like that. But it's very important to make sure that it suits you and your body, your condition and your baby. So before we do anything, we have to make sure that your body is suitable to that thing.
I'm sure our viewers must be smiling because when you're speaking to an Ayurvedic doctor, everybody is more home remedies, what they can do at home. But friends, like many a times we speak during our programs that everybody's body type is different. Do not experiment with anything that is being suggested. This is an overall information for a pregnant woman, and every body type is different. So do consult your Ayurvedic doctor before you take any over-the-counter or any home remedies that are prescribed here during the program. Now, let's also try to understand in this series today, what is postpartum depression? This term has been used quite often, and there is always conflict of thoughts in families, traditionally also, that my grandmom gave birth to 10 kids, but she never had postpartum depression. Maybe she never spoke about it. So what is it exactly, and how do you deal with that?
So first thing, postpartum depression, not everybody suffers with it, or maybe sometimes they do not understand what it is. But after when baby is born, that time everybody is happy, excited, everybody's focus is towards baby. And after all those 9 months having that physical and mental trauma and stress throughout the delivery, after that body will try to go back to normal. Uterus will try to go back to normal. It's a natural process. And that time, a lot of hormonal changes will happen. So typically postpartum depression will happen after 2 to 3 days after delivery. That excitement, that happiness slowly changes into depression, anxiety. Not depression directly, but anxiety, fear. That fear might be anything. That fear might be for herself, having body shame or having low self-esteem or low confidence. Sometimes they feel like this woman is working all the time, and now because of baby she is stuck at home. Sometimes they feel like I'm overweight, I'm not beautiful as before, and I got stretch marks, right? And sometimes this fear is for baby. I want to get best thing to my baby. and how can I manage it? How I will do this? How I will do that? I want to put my baby in this school. I want to do this thing with baby. So all that anxiety, all that fear sometimes might turn into depression because they will have sleepless nights. They want to feed baby, and if something happens to baby, for example, baby is not having milk properly, or baby has constipation, small things that will trigger mother's health a lot, like mental health a lot. So that anxiety or fear might be anything, reason might be anything behind it. But this is what we do through Matrujiva Mantra throughout the pregnancy. When you follow everything what we have told you, all the diet and exercise sessions, small exercise sessions, or yoga, meditation, that will make your mind and your body strong enough, capable enough to deal with this postpartum depression. If you see the statistics, postpartum depression is huge, and sometimes it can be so bad, they will try to harm themselves, they will try to suicide, or they will try to harm baby. That bad it is.
And I think
and
also
we are going to talk more about it in your third part for sure, like how
Absolutely.
we deal with it. Exactly.
And I think whatever you mentioned right now, it again goes back to the same thing: your dietary conditions, and what kind of nourishment goes, and of course your mental health. During the pregnancy, is whatever you're doing definitely comes out also after the delivery. Apart from the baby, there are a lot of other side effects which are coming in, because your mental strength is very much important. And in this series of Matrujiva Mantra, this is exactly what we're talking about. And you can reach out to Dr. Trupti Gaikwad and her team. They will be very happy to assist you during this process. And what I'm understanding from this conversation, Dr. Trupti, is it's more about conversations with the pregnant mom, giving her that comfort factor that some things which are happening with her is normal, and some surprises that have come can be dealt with. Is it so?
Yes, definitely. Absolutely true.
Yeah. This is wonderful. I look forward to our next episode with you on Matrujiva Mantra. Friends, this is a 3-part series where we're talking about preconception. And today we were talking about what happens during pregnancy, what happens to the body and mind of a pregnant woman, and how much support function is required from the family and the external factors that she's surrounded with. And in the third part of the series, we will be talking about what happens after delivery. What is the phase? What is the timeline for her recovery, for her body to come back to what she was before pregnancy? Thank you so much, Dr. Trupti Gaikwad. Your final words for our viewers today?
Yeah. So one more very unique thing we are bringing through Matrujiva Mantra is integrating values. So if you want to let your baby know what is honesty, what is encouragement, what is truthfulness, right? We all want, there are a lot of values. It depends on what we preserve, right? So during workshops, you will have some videos, or it is like homework to the pregnant lady, couple, I would say, where we will tell them, for example, you want to let your baby know what is encouragement or what is honesty. So we will provide you the information, documents, good videos, they come from you on YouTube. So small things. Whenever you are doing Google, when you are watching some YouTube videos or watching something on Facebook, so we will tell them, try to watch everything regarding honesty, everything regarding encouragement. So through you, your baby is trying to understand what it is. So like that, so many things we will be bringing. So stay connected. And yes, it's for better parenthood, and not just mother, even father is equally involved in all this.
And I think that's what we're going to talk about in the next part of the series. Thank you so much. It is a delight meeting you again and talking about Matrujiva Mantra. Thank you.
Thank you, Madhviji.